Hi, Dr. Tom Lewis here with Health Revival Partners, speaking today on the topic of cancer. Is cancer an infectious or inflammatory disease? And I'd like to share a slide deck with you to go over how I believe this is an important aspect that's overlooked in cancer and can improve both prognosis, outcomes, and actually lead to prevention of cancer as well. So let's go through this deck, and I pose the question, is cancer an infectious or inflammatory disease? And this is a highly overlooked causal factor and a preventable and treatable factor in cancer. And of course, if you don't test, you've guessed. So if we look at PubMed through Scholar Google, there are over 2 million associations between cancer and infection, and almost 4 million associations between cancer and inflammation. So the researchers have spoken. Now, if we look at cancer, the tumor is not a root cause diagnosis, but if you have a tumor, it must be treated. However, we also need to investigate what is causing the tumor and treat that as well. Otherwise, when cancer comes back, at least 25% of the time, it's much more virulent if we haven't treated the cause. So if we look at the American Cancer Society, anything from cervical cancer, gallbladder, lung, colorectal, have some type of infectious species associated with it, bacteria, virus, even fungi in some instances. HPV, very well known for cervical cancer, and you can be asymptomatic for HPV, Epstein-Barr, things like that, as the cancer is matriculating. But if your immune system's good, it can go away on its own. So we need to focus on immune health and overall health, but understand infection. So there's a number of doctors out there that understand this infectious connection. So here's a doctor that talks about viruses, bacteria, fungi, mycoplasmas, and then bad food, things like that, that put you at risk for inflammation. So these are factors we need to work on. Here's another one, genetic abnormalities. They're actually fairly rare compared to microbes, dental foci, which would be infection, and abnormal intestinal flora. The best treatment for an infection is a probiotic. So the probiotic fights against the pathogenic organisms. So it's a very good strategy. And the American Medical Association recently published this paper from Harvard that says the gut microbiome, good flora, can reshape cancer therapy. Why? By treating the tumor? No, by treating the infection that underlies the tumor, a very important concept. How do we measure if you have infection? We can look for the species directly, but the neutrophil to lymphocyte ratio, a very basic marker, well studied in cancer, is a reflection of your infectious burden. And an elevated neutrophil to lymphocyte ratio is a bad sign for cancer prognosis or even for cancer risk. But it's highly modifiable by your doctor and by yourself. And when I say your doctor, probably not a traditional doctor or an oncologist, but more of a functional doctor. And then there are a number of other markers, from killer cells to tissue destruction markers, inflammatory markers, and so on and so forth. And here's a couple of organisms that we look for routinely in our program. What we do is to help you understand where your risks really lie as we break cancer risk down into 6 categories: immune health, infection, tissue damage, inflammation, oxidative stress, and metabolic. And we want to get all these multifactorial factors into the green to really significantly lower your risk for future cancer. And then we give you an overarching score. Our philosophy on everything is, where do you lie on the health disease continuum? There's a cancer continuum as well. So we report to you what your cancer risk score and prognosis is, and where your position is on the cancer risk and prognosis continuum. And of course, we want to move everybody into the green. Almost everybody has truly modifiable risk factors that can be managed or treated to get you into the green. So once again, is cancer an infectious or inflammatory disease? It certainly is a piece of the puzzle that shouldn't be overlooked. In my opinion, it's a large piece of the puzzle based on cancer outcomes that we still experience as the #2 killer in the United States today. So it's Dr. Tom Lewis here. I hope you found this interesting, and I'd enjoy an opportunity to work with you and measure your labs and help you reduce your risk or prognosis for any type of cancer. Be well.